Health is a state of well-being. This includes not just the physical body, but also mentally, and to a large extent, socially.
My medical story, unfortunately, is long, extremely complicated, and difficult to share in a short period of time. The condensed version is that my life has been overwhelming and challenging, trying to live with being physically disabled and in excruciating pain every moment for the last 13 years. I was a very active and healthy person before the accident and subsequent failed surgeries. I now live in constant distress, it seems, unable to sleep most nights from the worries of financial destruction due to the rising cost of living expenses and increases, all in addition to the fears of my declining health and persistent medical issues because I cannot afford to pay for the proper care I need.
Even before we are born, there are factors that influence our health and well-being. Let's take a short quiz, shall we? What percentage of health outcomes do you think are influenced by social factors? For many years, it was thought the primary factors that shaped our health were genetics, the health system, health behaviors, eating healthy, exercising, or not smoking. However, we now know through an overwhelming and growing amount of evidence that the primary factors that shape health are people's social conditions. The World Health Organization recognizes the social conditions in which people are born, grow, live, work, and age as the social determinants of health. This concept is so important because if we are able to change our thoughts about what exactly is health and how to create it, then we can change our health system.
And it turns out that
health is created in families, communities, municipalities, through the volunteer sector, and through various social services. It occurs by addressing social determinants of health, like housing security, food security, transportation, social connectedness, freedom from abuse and violence, and so on. So while it's not the role of AHS or primary care to directly address these issues, it certainly is in our interest to screen for these factors and to help those agencies which address the social determinants. Because if the social determinants aren't addressed, then we pay the price in the medical system.
Community-based healthcare organizations and the primary healthcare team have opportunities to work together to support social, psychological, and biological factors that impact health. A strong pillar of this patient medical home includes accountability to the community by meeting the community's needs through interventions at the patient, practice, and policy level.
My ongoing recovery, both physically and mentally, has been beyond frustrating and tiring, mainly due to the current healthcare system. Emotionally, I am a wreck. Help and support is not easy to get or readily available unless, of course, you have the financial means to pay for much of it. Physiotherapy, specialized post-trauma massage treatments, osteopathic therapies, and so on. I lost my good-paying job. I watched my 30-plus year career dissolve along with my healthcare benefits due to my disability. So there is no extra money from the minimal disability payments I receive now to get the care I need.
Community-based healthcare organizations often include physicians, nurses, dietitians, therapists, and social workers, amongst other disciplines. Social workers play a unique role in addressing social conditions. A social worker is a professional that is educated and very skilled at examining the person in their environment while understanding and navigating complex service systems. Another question: how does a social worker address health-related social needs?
Social work is a profession that's grounded in a mandate to advocate and work towards social justice. We train our students to consider alternative perspectives, challenge the status quo, work at micro, meso, and macro levels. And I think those are tremendously valuable skill sets when you think of supporting patients and their families individually as well as across the healthcare spectrum.
Studies have shown that patients with access to a social worker on their health team used fewer and less costly health services, had significantly fewer emergency room visits, and had significantly fewer hospital admissions or shorter lengths of stay. But as a healthcare provider, supporting a patient's health-related social needs may appear daunting. What do I do? Where do I start? However, working collaboratively with your team can be an effective and efficient way to address patient needs and also improve job satisfaction. It's more effective to treat or support a patient trying to control diabetes by addressing their health-related social needs, such as getting healthy food, not skipping meals, or access to affordable tasty meals.
This all being said, I cannot say enough positive things about my primary care physician here in Lethbridge. She is an amazing person, and I am fortunate to have her fighting with me. She is so kind and compassionate. She listens and goes out of her way to help. She did the research to ensure she could provide the best possible care for me. The type 2 CRPS diagnosis, complex regional pain syndrome, caused by the surgery is rare, incurable, and causes massive nerve pain. People don't see this invisible disability, and it is not easy to manage with so very few treatment options out there. Medical forms required by both the provincial and federal governments to gain any disability supports or to see a specialist for treatment are constant and ongoing. Normally, the doctors must charge patients anywhere up to $200 to complete these forms, depending on how much time is needed. My physician knows my financial situation and typically does not charge me.
In Alberta and across the nation, there are many ways healthcare teams and social workers are coming together to address the social determinants of health in their communities. This could be at the individual, organizational, and/or policy level. Individual level factors are specific to individuals and can determine where we live, how we live, what we eat, and our ability to understand what makes us healthy.
From the question of how often are non-medical needs raised by patients and other healthcare providers to primary care nurses, the answer is almost always. At least 80% of the time, patients are bringing these concerns up themselves, and with a comprehensive and a patient care lens of the whole person. Primary care nurses during their assessment, if they haven't brought it up already, we're probably going to bring it up for them.
With the tangible presence of non-medical health-related needs in primary care clinics, there are a number of practical actions that healthcare providers are taking at the individual level, such as asking patients about social challenges. One nurse talked about asking patients, "Do you have trouble making ends meet?" Or is there always enough to eat at home? Another physician mentioned changing medication prescribed based on their client's income or ability to pay. Some healthcare providers are advocating for individual patient needs, such as writing a letter for housing or employment. Other healthcare providers are also referring their patients or prescribing social connection to local social service agencies. Most importantly, acting as a reliable resource person throughout the process. And of course, many healthcare providers are submitting referrals to their internal social worker. But what if your team doesn't have a social worker?
But we know that primary care nurses, especially in our rural communities, do not have access to social workers on a regular basis. So oftentimes it is the primary care nurse to help patients navigate through these issues. Oftentimes what we're doing in appointments are addressing and reducing financial impact to the patient, such as medication cost. We might be providing sample medications or doing an advanced authorization to get it covered by their benefit provider. We often refer to compassionate programs, start or enable counseling within the community. We do care coordination, we help them navigate the healthcare system, and most importantly, we build a relationship with the patient so that they are willing to bring up these issues to us and we can help them.
At the organization or team level, healthcare organizations are using qualitative data, such as presentations, lunch and learns, workshops, and quantitative data, such as community profiles or health trends, to influence services. One physician mentioned that their primary care clinic uses a virtual discussion platform where health and community professionals come together to brainstorm and discuss complex patient circumstances. Other healthcare organizations are inviting relevant stakeholders to talk to their healthcare staff. This included volunteer groups, nonprofit agencies, RCMP, and Indigenous organizations. One executive director of a primary care clinic mentioned doing this helped to highlight the gaps and challenges in services and also increase healthcare staff's awareness of local services available.
To foster a deeper understanding of financial strain and poverty, we've organized a Poverty Simulation Day. This immersive experience allowed our healthcare providers to gain firsthand knowledge of what it is like to experience financial strain and/or poverty on a day-to-day basis. By also including community members, our professionals developed a heightened empathy and a sharper perspective on the social determinants of health. Furthermore, we've created an up-to-date, user-friendly resource list of service agencies. This resource list includes not only government agencies, but also service clubs, volunteer agencies, church groups, and other key members, community members, and volunteers.
Systems-level determinants are social factors that occur at the systems or community level. These factors often influence the development of community resources and can also impact a community's ability to respond to adversity. Actions at the systems or policy level included healthcare clinicians using first-hand clinical experience to influence the agenda of their local community and also influence health and social care for primary care clinics across the province. Other healthcare organizations are enhancing accessibility of their infrastructure, such as wheelchair accessibility, ensuring suitable space for Indigenous ceremonies, or having physical, mental, and specialty services all in one place. Leadership at certain healthcare organizations are communicating population health needs to government and community agencies to influence public policy. These health needs were communicated to City Council leadership, hospitality and tourism industry, and all levels of Alberta's healthcare system.
And we now understand that most chronic disease, in fact, does have its upstream cause in community and family. And so if we do work effectively with communities and social agencies, not only can we prevent chronic disease, but we also know that we can't control chronic disease unless we first control and address social determinants. So in summary, it really is to everyone's advantage for us to work together in an integrated health and social care system so that we do have true health care.
We all have a part to play in conquering the burden of disease. Increased collaboration with healthcare team members and social workers who are well-versed in non-medical health-related services can be an effective and efficient way to improve population health outcomes.
We need whole person-focused care teams. That includes social workers in all primary care networks and clinics to support physicians and their patients, not just specific to the medical requirements. In addition to the financial concerns we have, there are many other challenges that affect people experiencing hardships and barriers due to their personal circumstances that need to be addressed for assistance. Seniors, disabled, Indigenous persons, and the homeless, just to mention a few, the most vulnerable in our society, need more support. With the support of my personal doctor, my battle continues, and I'm so grateful for her.
When community-based healthcare teams work together to address social determinants of health, it is an avenue for community, supporting community, for true health and well-being for all Canadians.